Thank you, guys. Sorry, I don't have a PowerPoint, which I'll spare you from having to look up there. I do have a few clips I'll show you, but my name is James Reid. I came all the way out from San Francisco, so I'm a little jet lagged, but I'll get through this. I work with an organization called the Lillian Lincoln Foundation in San Francisco. It's a small family foundation that's been around for about 30 years. With their mantra for the last 30 years is to make documentaries of stories that haven't really caught on. The stories in this world that they found were stories that nobody was talking about. So as I'll get on in a second, Snakebite was definitely fit the bill. This is about disease-specific approaches. I was not a disease-specific person 5 years ago. I worked for the CBS television networks, telling a whole range of stories on a nightly basis, some that would shock you, more of a comical nature of stories, human interest stories, great stories to talk over drinks, funny anecdotes. But when I left the network after 20 years, I was wondering what I was going to do, and I got a phone call. And this is where the word serendipity has popped up, I think, a lot in the last 5 years. I got a call from the Lillian Lincoln Foundation, and they had just taken over the foundation after Lillian Lincoln, the namesake, had passed away. So the son and daughter take over the foundation, and they go, we have to make documentaries now. That's the charge and the resources that we have to put out every year is making a documentary. But we have no idea what to do, except we just met a doctor in San Francisco who's creating a universal antidote for snakebite. And they said, snakebite? And basically, it kills 125,000 people a year. We're trying to create an antidote that any farmer can basically drink or have in their pocket and buy them time to get to the hospital. And they said, well, this is fascinating. So when they called me, they said, could you do a little research into this topic? And of course, we get snake bites in the San Francisco Bay Area. You hear about rattlesnake bites throughout California. I was like, I had no idea that it was such a global issue. And so I said, sure, I'll go away and do a little research. And within a few days, I called them back up and I said, we have to do this. Because at the time, there was if you Googled the word snakebite, you would typically get the number one thing that came up was snakebite the drink. Here's a great cocktail of cider and beer. And I was like, oh, this is crazy. There was no news articles. There were only, a few research papers that you could find from the same advocates, the same snakebite scientists that had worked on the issue for 10, 20, 30 years, but with no funding, no attention. And there were no documentaries. I'm like, this is perfect. So I got on the phone with a few of these snakebite scientists, and I really thought, well, if the need was as big, the problem was as big as what they were describing in countries, somebody had to go tell this story. So we pretty much quickly headed to 5 continents. We were in sub-Saharan Africa, Tamil Nadu, India, Papua New Guinea, Costa Rica. We went to film the science up at Liverpool School of Tropical Medicine. We really wanted to capture the day in the life around the world of what snakebite victims were facing and put their face on this issue. I'm going to start by showing you the trailer to the film so you can all kind of see kind of this story, and then I'll backtrack to tell you how this kind of advocacy movement has taken shape.
We've seen death, we've seen disability.
Being a victim, I've endured unbearable suffering.
We've seen disfigurement.
Crisis is a good word for what's happening at the moment.
Most victims of snakebite are amongst the most impoverished levels of the community.
I'm only asking God and wonder why this had to happen.
It's a cobra.
Okay, so the people raising their hands have been bitten by snake.
This is the reason why people get bitten by snakes all the time. Bare feet, bare feet.
Snakebite is the most neglected of all the so-called neglected tropical diseases.
So he sold 25 goats to buy the treatment for his kids, and now he has no source of income.
This is the only one left?
The platform for providing these antivenoms has collapsed.
Those who are manufacturing the antivenom are backing off.
If we are to save lives and limbs, this is the time for the whole world to wake up.
It's probably the best chance we're going to have to get snakebite properly on the world's radar.
Can you imagine some poor little African child with that happening?
The world has the capacity to deal with these problems.
Complete victory.
Getting this drug is a human right. It's not a matter of economic business.
Can you imagine the distress of running from your home, perhaps in the night, with a child on your back, suffering from snakebite, screaming in pain?
So that was the trailer, but if I back up a little bit, we came back with 250 hours worth of footage. And that's quite a feat. We were in hospitals where we'd spend 2 straight days just having snakebite patients coming in and out the doors. We'd go into a village in Kenya and we'd ask somebody, do you know somebody who's been bitten by a snake, or a family member, or somebody who's lost a loved one? And people would scatter all directions to go find people. And we knew as we were in the field filming that this was something that had to be told. And of course, this was at a time when there was no movement on the global stage. There were really hopes of getting the WHO to take on programs. And at the time, we decided we had to be kind of nimble. So we come back with all the footage, start building the ideas for the film, distribution plan. We didn't want to, it wasn't about going on Netflix, and it wasn't about going to film festivals and getting awards. We wanted to get kind of to the heart of the people that needed to hopefully eventually make decisions and that would come aboard a tent to help make solutions. So as we were developing all this and starting to put the film together, I was actually you'll meet David Williams in a second, but I was in Papua New Guinea with him where he was doing amazing work. And it just happened that they had just gotten an invitation to have a site event at the World Health Assembly. And this is back in 2016. And we put the film on hold to create a short video that they could show at this event using some of the most gripping images we had collected on the ground, so that we could really get member states knowing about the issue and start building noise and momentum. So we did that. It was a successful meeting, and that started leading to more work within the WHO. I'll get to that in a second, but I came back to doing the documentary. So we put the dust of the documentary back off. And so 2 years ago, we started screening the documentary. It's been screened over 400 times, individual screenings. Our main goal was to hit tropical medicine conferences, global health conferences, for which immediately the Wellcome Trust. Here we are in a room where the Wellcome Trust had actually come to one of our screenings at ASTMH in Baltimore, and this is their first time really hearing about the issue, to the point where in this very room they held a screening a few months later, and little would we know a few years later, like last year, they announced their £100 million project for donations investment into research. It's come a long way in 5 short years. So basically the idea with doing the screenings was doing global health university programs, really getting the studentry of this world involved, getting more interested in this as a topic that maybe they could further their studies. So it was all about building noise at a time when noise needed to be built. So So we started also doing advocacy in the United States, holding roundtables, using the film as door openers, but having roundtables in Seattle around the philanthropic and global health communities, having screenings in Washington, D.C. to bring in USAID people and NIH people, really trying to build the tent. And it's really had some amazing outcomes. And the tent is still building in this short amount of time. And basically, we've created this, with all this footage, it's been a repository of footage that never existed before. So it's being able to be used for the BBC calls or CNN calls, and they're doing a story on snakebite. This footage wouldn't have existed, and we're putting it to best use. Again, free footage, we don't charge anything for it, and it's using filmmaking for the best assets of broadcast as well. And so recently, we have kind of met the need to a lot of the new work that David's going to describe in a second about the snakebite strategy at WHO. Part of it's community education. So we just used some old footage and went and flew back to Kenya and Tamil Nadu, India, to create prevention videos that we just launched. And we're going to be doing them in Southeast Asia and Latin American versions coming up very soon. And that's basically to get these short videos in multiple languages, worked on by local filmmakers, and the actual content is worked with people in country. So we get very locational specific topics. But these prevention videos that are being sent out, I'm seeing them being used in churches and schools by advocates that are on the ground in all these different countries. People are sharing them on WhatsApp. And I just had a meeting with WhatsApp last week to try to actually work on how do we get these videos down to the ground to our community healthcare workers that we know have community healthcare groups. How do we get these videos down to the ground and really access them to the farmer who has the mobile phone? So we keep adapting, and we're very nimble to this kind of using film as a movement to make change. And with that, David Williams is going to talk a little bit about the WHO strategy, and we're going to also have a workshop tomorrow. This is a snapshot, but we'll have a workshop tomorrow afternoon to kind of go into greater depth and also talk about how we need more collaboration with people that are in this room to grow this tent we've been building. Thank you.